Chapter 3, the Integumentary System. Please take a few minutes to read through these learning outcomes on the 3 slides. Lesson 3.1, Functions and Structure of the Skin. Protection. The skin is a physical barrier against injury, chemicals, ultraviolet rays, microbes, and toxins that is not easily breached. Water resistance. We don't swell up every time we take a bath because our skin is water resistant. It also prevents water from leaking out of the body tissues. Temperature regulation. A network of capillaries in the skin opens up or dilates when the body is too hot. When the body is cold, the capillary network narrows, blood flow decreases, and heat is retained in the body. Vitamin D synthesis. As little as 15 to 30 minutes of sunlight daily allows skin cells to initiate sufficient metabolism of vitamin D, which is essential for bone growth and maintenance. Sensation. Nerve endings that detect touch, pressure, heat, cold, pain, vibration, and tissue injury are particularly numerous in the skin of the face, fingers, palms, soles, nipples, and genitals. Excretion and secretion. Water and small amounts of waste products from cell metabolism are lost through the skin by excretion, and the secretion from sweat glands. Social functions. The skin reflects emotions, blushing when a person is self-conscious, going pale when a person is frightened, and wrinkling when a person dislikes something. The skin receives more care and treatment than any other body system. The skin is part of the integumentary organ system. The system consists of hair, skin, nails, sweat glands, and sebaceous glands. Discussion board question of the week. Describe the function of the skin as it plays in our physical well-being. The protection, homeostasis, sensation against injury, and social functions. Also, describe how the skin plays an important part of our self-image. Compare the appearance of normal skin with that of acne, eczema, and venous stasis of the legs. There's a difference between biopsy and autopsy. Biopsy is the removal and examination of living tissue. Autopsy is the removal and examination of dead tissue. The suffix opsy means to view. The root bi means life. Carcinomas, cancerous masses, develop frequently in the skin and travel, metastasize, to other areas of the body. Their prefix cryo means cold. Cryosurgery is the application of freezing devices. It is often used in skin surgery. What is the practice of dermatology? It's the study and treatment of the integumentary system. What's the name for the medical professional who treats the diseases of the skin? Well, that's a dermatologist. Dermato is the combining form for skin. Now, the difference between dermis and epidermis. The dermis, derived from the Greek skin, is the connective tissue layer of the skin beneath the epidermis. Remember, epi means above. Dermis also means skin, just like dermato meant skin. So between dermato and dermis, both root words pertain to skin. Epidermis, or epidermal, would pertain to the outer layer skin. Cutaneous means pertaining to the skin. Cutane, another combining form for skin. Compare it to dermato. What is the difference between a prognosis and a diagnosis? The prefixes provide the difference. Gnosis means having a knowledge about a condition. Diagnosis is identifying an illness or condition. The prefix dia means complete. Prognosis is having knowledge about the course of a condition or treatment. The prefix pro means before, to project forward. Use figure 3.2 to identify the various layers of the skin. The stratum corneum is the outermost layer of the epidermis. It is made up of a layer of compact dead cells packed with keratin. These are dead cells with no nuclei. This is what is continually shed. Dandruff is clumps of these cells stuck together with sebum, which is oil from sebaceous glands opening into hair follicles. In this structure does the stratum lucidum exist on the palms, soles, fingers, and toes. Can you see that? In the lower layers of the epidermis, cells are filled with a protein that becomes keratin. Other cells produce a brown/black pigment called melanin, which determines the color of skin and also protects the skin from damage by ultraviolet light. The suffix "in" means substance. Kerat means hard protein. Keratin is protein present in skin, hair, and nails. Melan means black. Melanin is a black pigment found in skin, hair, and retina. Sebum is the Latin word for tallow or candle wax, and is a waxy secretion of the sebaceous glands. Intradermal, within the epidermis. Subcutaneous, below the skin. Intramuscular, within the muscle. Transdermal, going across or through the skin. Identify the prefixes in the terms. What are the different routes for injections and medications? Transdermal applications are medications placed on the skin that diffuse across the epidermis and enter the blood vessels in the dermis. These medications are placed on a special superpermeable membrane material that allows absorption of the medication through the skin. Examples of transdermal medications include cardiac medication, birth control patches, nicotine patches, and hormone replacement such as testosterone patches. Both adipose and lipid mean fat. What is the difference in their definitions? Adipose consists of a suffix "-ose" or full of, and a root adip, which means fat. Adipose means containing fat. Fat has positive effects that help insulate and protect the body from injury. Lipid, from the Greek fat, is the general term for all types of fatty compounds. The root alges means sensation of pain. The prefix "an" means without. An analgesic is a substance that reduces or relieves the response to pain. Follicle comes from the Latin word meaning small sac. It is a mass of cells containing a cavity or small cul-de-sac, such as a hair follicle. Hypodermis means a tissue layer of skin below the dermis. A wheal is a small, tiny swelling that is itchy on the skin. Dermatitis is an inflammation of the dermis caused in different ways. An example would be allergic or seborrheic or contact. What is an allergen? Any substance that causes an immune reaction is an allergen. Do you know an example of an allergen that can cause atopic dermatitis? Well, I can tell you a few, just in case. Poison ivy, poison oak, nickel, cosmetics, lotions, soaps, clothing fibers, etc. Anything that comes in contact with the skin can develop to be an allergen. Pruritus is the medical terminology for the word itch. Eczema is a general term used for inflamed, itchy skin conditions. Eczema is an itchy red rash that weeps serous fluid that may become crusted or scaly. Exoration refers to scratch marks. The process of dermatitis includes contact dermatitis, results from direct contact with irritants such as allergens. Irritants include soaps, detergents, cleaning products, and solvents. Atopic or allergic dermatitis, caused by allergens that include nickel and jewelry. As with the Miss Fox in Case Report 3.2. Perfume, cosmetics, poison ivy, and latex. Seborrheic dermatitis produces a red rash overlaid with a yellow, oily scale, common in people with oily skin or hair. Status dermatitis occurs in the lower leg when varicose veins slow the return of blood and the accumulation of fluid interferes with the nourishment of the skin. Why is sunlight a danger to skin health? It can cause burning and cause cancers to develop. What is the meaning of the common element from the terms listed? The root all means strange or other. The root erg means work, activity. What is the meaning of the element gen? Gen means producing. The two adjective terms for those listed are allergic and allergenic. They have a common suffix, ic, means pertaining to. Malignant melanoma is a type of cancer that is formed from the cells that produce melanin. It usually begins as an irregularly shaped black mole. The cancer cells can spread throughout the body, metastasize. What's a risk factor for developing malignant melanoma? If you said exposure to excessive sunlight and tanning, plus overexposure to ultraviolet radiation, you would be right. Other types of skin cancers include basal cell carcinomas, which come from the basal, which means bottom layer of the epidermis. This is the most common skin cancer and the least dangerous because it does not metastasize. Squamous cell carcinoma, which comes from the cells in the middle layers of the epidermis. Why is sunlight a danger to skin health? Have you ever had any problems with excessive exposure to sunlight? And if you answered causing burning and cancers to develop to the previous question, you would be correct. Malignant, tumor that invades surrounding tissue and metastasizes to distant organs. Melanoma, which is a malignant neoplasm formed from cells that produce melanin. And then we have metastasize, which means to spread to distant parts. Identify the roots in these terms. Pressure or debicuitous ulcers are when a patient lies on one side for a long period of time. Blood supply is cut off to the skin, allowing germs to enter the body. Congenital lesions, like nevus, a birthmark caused by an abnormal pigmentation or proliferation of the blood vessels. Examples would include a port wine stain on the back of the neck that resolves around the first 2 years of life. A blue-gray benign flat Mongolian spot could be on the lower back. Identify the elements in the terms debicuitous. The prefix is D, de, that means from. The root is cubitus, cubitus, which means lying down. Nevus is a congenital lesion of the skin. Have you ever seen any of those? The skin can be susceptible to many different types of infections. These infections can be categorized as viral, fungal, parasitic, or bacterial. What's the virus that causes warts? If you said human papillomavirus, you would be right. The human papillomavirus invades what layer of skin? It's the epidermis. In figure 3.8, you can see what warts look like. Anybody here ever had one? What's the more common name for the varicella zoster virus? If you said chickenpox, you're right. What condition can the dormant varicella zoster virus cause later in life? Well, that would be shingles or herpes zoster. It is extremely contagious. In figure 3.9 in your book, you will see the appearance of shingles. Macule, or Latin for spot, flat spot or patch on the skin. Papillomavirus, virus that causes warts and associated with cancer. Papule, meaning pimple or small circumscribed elevation on the skin. And verruca, Latin for wart, wart caused by a virus. Tinea, a group of related skin infections caused by different species of fungi. Where do fungi live on the skin? Fungi are found on the non-living stratum corneum and its derivatives, hair and nails. Where is Tinea pedis found? It's found on the foot. It's better known as athlete's foot. Look at figure 3.10. What are the locations for the following fungal infections? Tinea capitis, Tinea corporis, Tinea curious, and Tinea vesicolor. Look that up. Can Candida cause recurrent infections? The answer is yes. Can you name a recurrent infection caused by Candida? It's called thrush. Thrush is commonly seen in infants who are bottle fed and in patients receiving chemotherapy. It's characterized with white hair-like growths on the tongue and palate. Another way to obtain thrush is by using oral inhalers. On all package instructions, they tell you to rinse your mouth out after the oral inhaler has been used. Not doing so could cause thrush to develop. So what is a parasite? A parasite is an organism that lives in contact with and feeds off of other organisms. How does an infestation differ from an infection? An infestation is a parasitic attack or substance on the skin and its appendages. An infection is caused by a disease microorganism that releases toxins or invade body tissues. Look at the elements of the words infestation and infection. Infest means to invade. The suffix ation means process. The root infect means internal invasion, and the suffix ion means action. Lice are small, living, bud-like parasites that require a host on which to live. Pediculosis is the name of the disease caused by an infection with lice. Identify the elements of pediculosis. The root word, pedicle, means louse. The suffix osis means condition. Define itch mite. An itch mite is a parasite that lays eggs under the skin. An infestation in which the itch mite produces scabies. A symptom of scabies is intense itching rash, most commonly noted between the fingers. So what is a dust mite? Like a house dust mite? What objects do dust mites live on? What part of the mite causes an allergic response in humans? You might want to look into that. Staphylococcus aureus is shortened to staph. Identify the skin infections often caused by Staphylococcus aureus. Staphylococcus aureus is the cause of pimples, boils, impetigo, just to name a few. Okay, let's take a look at the difference between these two terms, or three. So we have a carbuncle, which is an infection of many hair follicles in a small area on the back of the neck. We have impetigo, which is an infection of the skin that produces thick yellow crust. We have scabies. So that's going to be a disease that produces by mites. Collagen is a fibrous protein. Collagen diseases attack collagen or other compounds of connective tissue. So let's look at systemic lupus erythematosus, otherwise known as SLE. It's an autoimmune disease, occurs most commonly in women, and produces characteristic lesions. The most characteristic feature is a butterfly-shaped rash on both cheeks joined across the bridge of the nose. Figure 3.15 illustrates this for you in your textbook. Rosacea is a rash that looks similar to SLE, but it's produced by large capillaries. So scleroderma is chronic, persistent autoimmune disease characterized by a hardening and shrinking of the skin that makes it feel leathery. It is most often occurring in women. It can attack other organs, not just the integumentary system. It can also attack the heart, lungs, kidneys, and organs of the digestive tract, as well as joints. Scleroderma is associated with breast cancer. Use figure 3.16 to review scleroderma. Okay, psoriasis. Psoriasis is itchy, flaky, red patches of the skin of various sizes covered with white or silvery scales. So now let's look at vitiligo. Vitiligo produces pale, irregular patches of skin. Which of these two diseases has no cure? If you chose vitiligo, you would be correct. Please take a moment to sound out these medical terms. You need to emphasize the syllables in the bold face type. Psoriasis. The P is silent. And again, that is the rash with the silver scaled patches. Rosacea, otherwise known as persistent erythematosus, rash of the central face. And then scleroderma. So that's going to be a thickening and hardening of the skin resulted from new collagen formation. Lesson 3.3, Accessory Skin Organs. Look at figure 3.19. It's a hair follicle and the associated sebaceous gland. What do sebaceous glands secrete? Oh, well, that's oily acidic sebum. What probably triggers excess oil production? Male hormones called androgens. So what exactly is acne? Acne is hair follicles blocked by excess sebum and broken down keratin cells from the base of the hair follicle. This is a comedo, or whitehead or blackhead. If, when ruptured, allows bacteria to enter, it can form a pustule. This is most common amongst people from the ages of 12 to 25 years. A cyst is an abnormal fluid-filled sac surrounded by a membrane. A comedo is a whitehead or blackhead and is produced when too much sebum and too many keratin cells block the hair follicle. A pustule is a small protuberance on the skin containing pus. So let's talk about seborrhea. This is a noun. The adjective is seborrheic. The suffix "ria" means to flow. The combining form of sebo means sebum. Therefore, seborrhea is an excessive amount of sebum. Define the term alopecia. If you said thinning of hair, that would be correct. So where's your axillary hair? That's right, it's in your underarms. So what purpose did hair serve during the evolutionary process? Provided warmth. Okay. What purpose does hair serve now? Question for thought. Humans have 3 million to 4 million sweat glands scattered all over the skin, with concentrations on the palms, soles, and forehead. The main function is to produce the watery perspiration, sweat, that cools the body. There are different types of sweat glands. Some produce sweat and some produce smell. So the types of sweat glands are merocrine, apocrine, ceruminous, and mammary. Where are the merocrine glands found on the body? Well, they're found all over the body, but they're concentrated on the palms, soles, and forehead. Now, which gland produces thick, cloudy secretions that produce a distinct smell? That's your apocrine sweat glands. What's the name of the gland that's found in the external ear canal? Yeah, that's your ceruminous, right? Because it produces cerumen, which would be earwax. And then which gland is part of the female reproductive system? Well, that's going to be the mammary gland. The apocrine gland is also part of the mammary system, and it secretes lipid droplets during lactation. Check out figure 3.24 in your workbook. It's going to show you onychomycosis. Note that the nail becomes brittle and cracked. 50% of all nail disorders are caused by a fungus. Frequent hand washing, warmth, poor hygiene, and frequent manicure/pedicures without sterilized instruments. That's going to be your causes for nail fungus normally. Use figure 3.25 to look at paronychia. So paronychia is a bacterial infection at the base of the nail. Most common cause of it is Staphylococcus, and nails can also reflect systemic illness or conditions such as hypoxia and malnutrition. All right, go ahead and identify and define the meaning of the word elements listed above. So the suffix osis means condition. Onchyo is the combining form for nail. The root myc means fungus. So onychomycosis is a condition of fungus infection in the nail. Suffix ia is condition. The root again is onc, meaning nail. The prefix is para, which means alongside. Thus, paronychia is an infection alongside the nail. Lesson 3.4, Diagnosis and Treatment of Skin Disorders. The dermatologist will use a dermoscope to highlight the skin lesion. The instrument shines a light on the skin and magnifies the lesion. A biopsy is used for the removal of part of the lesion or the complete lesion, particularly if cancer is suspected. The specimen can be sent to a lab for examination by a pathologist. Topical therapies are the most commonly used method of treating skin disorders. Cleansing agents are used to clean wounds and abrasions and to remove crusts and scales. These include soap, shampoos, and detergents. Anti-inflammatory agents are most commonly corticosteroids, are lotions, gels, creams, or ointments. Examples are hydrocortisone, triamcinolone, and betamethasone. Topical antibiotics are seldom indicated. Clindamycin and erythromycin are used to treat acne or impetigo. Over-the-counter antibiotics such as bacitracin and polymyxin can prevent infections and scrapes. Antifungal agents can be bought over the counter and include Lamisil, Miselex, and Lotrimin. Antipyretics such as diphenhydramine and hydrocortisone treat itching. Systemic therapies are given orally, by injection, and intravenously, and affect the entire body. What's a common OTC topical therapy that would be over the counter that maybe you've used? Lesson 3.5, Burns and Injuries to the Skin. Look at figure 3.26 as it illustrates a first-degree burn. First-degree burns are also known as superficial burns. What can cause a first-degree burn? If you said prolonged exposure to the sun or short exposure to a hot surface, you'd be correct. Often first-degree burns require no medical attention and leave little to no scarring. If you look at figure 3.26b here, it illustrates a second-degree burn. What layers are affected in a second-degree burn? Well, that's going to be the epidermis and the dermis. Second-degree burns are also known as partial thickness burns. They require medical attention and may produce scarring. What are signs of a second-degree burn? That's going to be redness, blisters, and severe pain. Use figure 3.26c here, and you're going to see a third-degree burn. What layers are affected in a third-degree burn? That's going to be the epidermis, the dermis, and now the subcutaneous tissue. Third-degree burns are known as full-thickness burns. They require medical attention and require skin grafting. Fourth-degree burns destroy all of the layers of the skin and involve tendons, muscles, and sometimes bones. What can cause a fourth-degree burn? Exposure to high-voltage electricity. What structures are destroyed in a fourth-degree burn? The skin, bone, muscle, and tendon. Burn injuries to lungs from heat or smoke cause 60% of burn fatalities. The rules of 9. Head and neck are 4.5% anterior, 4.5% posterior. Each arm is 4.5% anterior, 4.5% posterior. Each leg is 9% anterior, 9% posterior. See figure 3.27 on page 52 of your textbook. Edema. It's a noun. Edematous is an adjective. So edema, a swelling. Do you know what areas of your body are prone to edema? Most commonly, that's going to be the feet, ankles, lower legs, fingers, and eyelids. So here's a noun for you, inflammation, followed by an adjective. That would be inflammatory. So inflammation, a complex cell and chemical reaction occurring in response to an injury or chemical or biologic agent. All of the words on this slide share a common root word. The root word is graft, which means transplant. So let's look at the prefixes. Auto. What does auto mean? Oh, self. Kind of like automatic or autonomic. Okay. Homo means same or alike, right? Like homogeneous, right? Allo means other. Xeno means foreign. Hetero means different. Which of these prefixes share common definitions? The answer is allo and homo. In a superficial laceration, such as a shaving cut, the epithelial cells along the edge divide rapidly to fill in the gap and heal it. Figure 3.28a here illustrates what occurs when the wound is deeper or the skin has been incised. Blood vessels in the dermis are broken and the blood escapes into the wound and a clot forms. Figure 3.28b illustrates what occurs when the skin has been lacerated. After a clot forms, what cells arrive to clean up the debris? Well, those are called macrophages. The surface of the clot dries and hardens in the air, and that forms a scab. What's the purpose of the scab? Well, it's to protect the wound from becoming infected. And if you take the scab off, your body has to build a new one before it can continue to heal. Therefore, don't pick your scabs off. After 3 or 4 days, the clot is invaded by new cells that form collagen fibers, and that forms granulation tissue, and then those together will form a scar. Suturing is manually bringing together the edges of a wound. Suturing material can be non-absorbable, absorbable, or liquid adhesive. Keloids are excessive fibrosis that occurs in the wound, making the scar raised, irregular, and lumpy. All of the above words share a common suffix, plasty, which means surgical repair. An abdominoplasty is a tummy tuck. A blepharoplasty is the correction of like a drooping eyelid. A mammoplasty, that's going to be adjusting the size or shape of the breasts. A rhinoplasty, well, that's a surgical procedure to alter the size or shape of the nose.